My name is Christian Muller, and I am the Division Chief of Pain Management and also a staff neuroradiologist at Fairfax Radiology. And today we're going to discuss a little bit about epidural and selected nerve root steroid injections for treatment of spinal disorders, specifically axial back pain as well as radiculopathy in the upper and lower extremities. In essence, they're very, very similar. When lay people hear epidural, they think they're about to have a baby. And that makes sense because in usual parlance, people hear, oh, I had an epidural, I had it there, well, you had a baby. The epidural space is a location. It's just an anatomic location. It's like Kentucky. And so if you're going to have a baby, the anesthesiologist will thread a catheter in there and they will flood it with anesthetic to numb you from your navel down to enable delivery to happen with far less discomfort. We go to the same place, but we use a small needle and we don't have a catheter. So an epidural injection is really the most generic injection that we do. If someone has axial back pain or someone that just has midline back pain or pain radiates down to the buttocks, but they don't have leg pain or they don't have arm pain, we'll generally start with an epidural. The analogy I give patients is that's like when you're painting a room and you're using the roller on the walls. That's just large, broad area, kind of a shotgun approach. It just sprays the water of the fireman onto the wall and tries to calm and cool everything down. Other situations are where you have the MR and you see that there is a disc herniation which has come out of its native location, and it's sitting on a particular nerve root, leading to compression and irritation. And in that case, we will actually use more of a rifle or a sniper approach, and that's when you're painting around the edges of the windows or painting along the edges of the doors, where you're really specifically trying to treat an individual structure because you know based on that patient's symptomatology and their MR that that's their specific problem, and you don't have any doubt about that. And so that's where the nerve roots come in, and they're done exactly the same. You as the patient won't know the difference. We're coming in from a little bit more lateral approach, and we come down to the edge of the frame and along the nerve root, and we really focus the majority of that steroid and anesthetic on that nerve root. It also goes backwards through the frame and into the epidural space to where the disc herniation is. But that's really the difference between the epidural injections and the selected nerve root injections.